Good afternoon, Council. This is our setup for the wearable asthma monitoring device tailored for children, sponsored by Myosa. So first of all, we have our battery that's going to power the whole system. Then we have our boot booster that's going to keep the power from 3.7 to 5 volts. This is going to power the Myosa board, where we're going to connect it to our accelerometer on the bottom. And we also have our OLED display for the display of the beats per minute and the respiratory rate. Then this is connected also to the sensor, the Max 3001, that is connected directly to David, my colleague right here, where we have a connector with the left arm, the right arm, and the right leg. So this is a 3-lead configuration for the extraction of biopotential signals. As we can see, David has approximately a beats per minute of 85 and a respiration rate of 16. As we can see, both values are equal. The OLED display and the values from the app. We're gonna make David run a little so he can simulate a potential asthma event. So we're gonna be back in 5 minutes.
Now David is connected after running, and we can see that his heart rate is elevated. If we focus on the app, we can see that his BPM right now is at 112, 113, 114. What we want to do is remember the thresholds that were inside the PowerPoint presentation. As soon as his BPM goes above 120 and his respiration increases, as we see here, we get a warning. As soon as that BPM increases to above 150 and his respiration stays above 30, we will see an emergency, which is what you see here. These thresholds are implemented as for a child of age 7 years old. The thresholds change as the child grows. And as you can see, as soon as the BPM creates or changes a BPM or a respiration value, it is immediately changed and sent to the app. As you can notice in the app, not only do we get a push notification, but you also get the warning and emergencies inside the app. This is to ensure that there is proper notification for the parents. If you notice as well, there are different tones to each alarm and different durations for each. The warning is a small ping that lasts maybe 2 seconds, and the emergency lasts closer to 15 to 30 seconds with the sound that is a little bit more elevated. This is all to ensure that not only do we get correct warnings and emergencies, but if the parent or caregiver of the child is not close, they can hear the alarms and know exactly what is going on. In case the parents or caregivers have their phone on vibration mode for notifications, the duration period is set so that they can not only differentiate the alarms by the sound, but also by the duration of the alarm. That is how our apps works. Thank you.